Good afternoon. Here we are in Ways and Means. It is Tuesday, March 17th. We are beginning our work for the week, which will be many brief moments with many bills from other committees. Really, again, encourage folks to take a look at the bills that are in committees that you are the liaison for, and please, if you identify something that you think will need amending, please let me know sooner rather than later. Thank you. So we have everything that we're going to need to cover for crossover on our agenda, to the best of my knowledge. So there'll probably be one surprise, but right now there are no surprises. Shouldn't have said that out loud. So today we're doing school budgets updates. As per the usual, we're gonna look at some amendments to the Medicaid school-based services program language and ideally vote and move that on to the appropriations committee. And then we have H 931, which is another education bill, which we have quite limited jurisdiction over in terms of why it was sent here. And then the yield bill. We're gonna wrap up by 4:23. With that, Kelly, would you like to join us? Thank you.
Hello, everyone. Kelly Murphy, Education Finance Director. I'm just going to go ahead and share my screen. So I've got the memo that's included online for you queued up here. So I just want to start off by saying that we've got most of the budgets in at this point. I'm happy to report that we've got 116 budgets in of the 122 that we were anticipating. And so I'll give sort of the report out on that. But the bottom line is things changed ever so slightly. We were at 4.2%. We're now at 4.15%. So there wasn't really a dramatic change adding those budgets in. We are still monitoring pretty closely for the 30-day petition period. And also just taking into account the failed budgets, which we still have in this presentation for update. So just getting along into the bullets. But before I do, I also want to note another change that we did encounter. There was a change to the long-term waiting file. It came to our attention that we had not captured Newberry's census data correctly. And so what had happened is when we got that census data in, we included Wells River in that number. And as a result, it was throwing off the sparsity in small school weights. We have corrected for that. And thankfully, there was time enough for them to be able to warn their budget appropriately. So the impact, while there's a change in the weight, can still be accounted for in the full process. So I did want to note that.
Yeah, absolutely. Thank you.
My understanding from the superintendent is there was also an adjustment in the Oxbow budget.
Yes, so I did not pull the details for the budget, but there were changes based on sort of they ended up getting the sparsity.
Was it the same error that affected the Oxbow budget that affected the Blue Mountain? And they did already vote. They made substantial cuts and voted. And then how did that change affect their weighted count?
So Newberry then became eligible for the sparsity small schools grant, which they were not with the census data that we had booked previously.
And how did that affect the Oxbow budget?
The Oxbow budget, I don't believe there was as much of an impact, but I can double check that.
That would be helpful if you could.
Yeah.
Right, I understand because we've talked about, we're seeing what the adjustment is to Blue River, but I'm just trying to figure out, that budget is already voted. It's not included here, but I'm curious how it's going to change or affect the long-term community of their tax rate.
So I had not.
So have they not voted?
So I believe that's correct, right? So it will
Okay,
impact
they're
their
one of the
budget.
ones when it comes.
Yes, but,
The cuts have been made already on the proposed budget.
yeah, so
Based
it,
on incorrect information.
right. So we had gone through the certification process, with them and then realized, you know, in the in-between here that it was not accurate.
And they had certified the data? Okay.
Um,
But they
And then I'm gonna finish my whole sentence, thank you. And then after this, I just want to make sure I understand the timeline. You all certified the data jointly. They warned a budget based on the incorrect information. The information got corrected, and then they've corrected the warned budget.
Right. I don't think they.
Okay,
So we got it in time, basically.
okay.
for Blue Mountain, but not for Oxbow.
So I will clarify, I'll double check on that and come back to you with that. But I'm under the impression, based on the changes, that there is still time to warn appropriately and to catch them in the tax rate
I don't
process.
think we now expect at least that.
Okay, so can you look into it and sort of clarify timelines for us?
Yes.
That'd be really helpful.
Can do that.
Appreciate that. And that data error, is that, are you checking, is that widespread? Are there other places where there might be data errors?
There was only one other place, but it was not impactful. It did not change the budget outcome.
Are you identifying errors because districts come to you, or are you identifying errors because you're looking at data and saying, that doesn't make sense?
In this particular instance, they came to us. We, like I said, we had already gone through the certification process, which did capture this error. That said, we did look into it. We, you know, have identified it within the file. We have to prevent it from happening again.
Follow up, and the reason I ask is I'm concerned about the certification process because we've had numbers of districts on our side of the state, including my own, that went to budget with an asterisk saying we've been told we have to sign off on this. So I don't know that it is that certification means they necessarily agree with the count. And my understanding is they actually had concerns and found that, and that's why it came up. And the reason I ask is I'm also looking at table 5. And, it just jumps out at me as a district, that is a pretty high poverty district, should be experiencing a growth in long-term weighted ADM, and had, per the data that you're providing here, a pretty significant decline in student counts. And I'm just wondering how a district of that size, has anyone looked into whether they've had an error there too? Because it's a pretty significant decline in student count for a district we'd expect to be increasing its long-term weighted ADM. So I'm just wondering if part of the process is just looking at the data to try to identify if there's patterns that ought to be investigated.
Sure, totally up for investigation. And also appreciate the questions so that we can look into them and make sure that we come back with answers. And I think for the purposes of today and with this presentation, it's sort of in some form, but if there are questions, we are most certainly happy to bring them back. And also validate and make sure that we're going through the certification process appropriately. And then if there is something that's not correct or that we need to address, we will.
This has happened in past years as well, and I think it's just for getting to really good data integrity, I think there's a real question about how I think it would help us to better understand how districts come to the decision to agree and certify and how much attention they're giving to it on that side, as well as how you're sort of, scanning for anomalies before you finalize the batch. Like in full tax world, right? Like we have all of these measures of inequity in the data sets that we can run to look at. And I imagine there are ways to sort of scan for errors or anomalies. Yeah.
We definitely didn't scan it
Okay.
in the process, and there were anomalies or large discrepancies. We made a list and we reached out to those districts, and they also saw the issues, and so it was a two-way process. We noticed things, they noticed things,
Okay.
things we found 99% of the issues this was one issue that was kind of very kind of neat with the census data.
Okay.
Hopefully they had somebody in their school board that was. insightful.
Thanks.
Anything more on the weighting that we want to talk about, or just we'll bring back and I get my. Or we'll bring back more detail in terms of just, process elements, certification.
Okay, great, thank you.
Okay, perfect. So just running through just the projections and what they represent. So 5 districts now are using the projected average increase of 4.15%. We have been contacting districts to get that information in, and are working through the certification process to make sure that they have signed off on those budgets. So I guess what I would say at this point is that these are preliminary numbers. We do have most certifications, but there are a few that we don't yet have. So we're closing the loop on that as we sort of build towards the final collection. I'm happy to report that, we're almost there. We've got 97% collected, and then we've got 96% of the weights and the education spending in. And so we're really coming into focus now with, having it be a pretty good estimate based on warned and voted budgets. But then just moving along, there was some interest in talking about excess spending. So this next table that we've prepared are the districts that we're capturing at this point that do have excess spending. I will note that these districts are not those that are projected. So this could potentially still change as we get additional budgets in. But what we've done here in this table, and I can provide a little more detail if needed, but the blue shaded columns are the change and the purple shaded columns are the adjustment. And so what you can see is these are the 8 districts that are above the threshold. So the threshold is 16,470. That is 118% of the state average adjusted for inflation. And then when you apply that, that's where you're getting this total amount over threshold. So applying it to the weighted ADM, and then we've adjusted for education spending, and then adjusted for the weighted ADM after you cut the adjustment in there.
Sorry, Danville was $493
Yeah,
in their total budget over the threshold?
yeah. So there was one, the Danville was very, very close. It's, 98 over the threshold, 0.98. So they're right there. And so, but the others are not as close, but that's.
Yeah, that just strikes me as bizarre. I don't have any explanation for it. Just
Yeah,
because I know the Superintendent's Association, School Boards Association, and everyone I've ever talked to who does school budgeting has talked about sort of how closely they watch that line, and
yeah.
I imagine the tax impact of $493 is also not that much.
Yes.
Okay.
So, we did publish the threshold when we sent out information to the districts. So there was an awareness of what it is. But it is like one of those where you're like, really? It's pretty low in the whole scheme of things. So this is where we stand today. We'll keep updating this table as we get more information in. And I'm also happy to add columns. I just wanted to provide a summary for you. So then moving along, unless there are questions.
Observation, I think relates to Representative Hartsville. It's interesting that 4 of those are on the Connecticut River in the Upper Valley. One of them, Jay, can't make cuts without forcing Westfield to cut. And then it's Canaan and Woodstock, which is also Upper Valley.
Sure, I guess that's a question for me as well, maybe is, I know Jay Westfield is a combined school. Is there any reason it isn't addressed in that way? Just saying Jay, not J/Westfield?
Separate districts just for the elementary school. There are separate districts at just the elementary level, and then they're in unified districts at the middle and high school level.
Okay.
So this is probably driven by the elementary school.
Okay, yep, got it.
Yeah, Representative Bodie.
Thank you. So I heard you say it's probably driven by the elementary school. Is that, do you have a commentary editorializing about what's happened up here? You know, what do you see? Are there themes? Or what should we be looking at? What do you have to say? I don't know these areas enough to know what is happening here.
Well, in a future presentation, I'll come back with more detail. But at this point, I don't know that I would want to editorialize until we have them all in. Because I'd like to also talk to the districts independently just to see, you know, what maybe some of the decisions or factors are that, you know, are playing into, you know, their budgets. And so I don't have an answer for you right now, but I will look into it.
Thank you. I think that would be good. Trying to make policy.
Absolutely.
Thank you very much.
Thank you for the question. Okay, so this next section, when I was in last, I did hear you in terms of wanting to compare education spending and also total budget. So this first set of bullets is just taking a look at the ranges for total spending. So not taking into account the offsetting revenues. And so just looking at total expenditure, there were 12 districts that decreased in total expenditure, averaging downs of 4.2%. And you can see what the ranges are here within the budgets, and they're pretty extensive. I do have an email or two out just to kind of understand the upper end of that range and sort of, you know, what the spending is in their budget. And then the second bullet is just showing, you know, who's up over the 5.8%, much like we were showing the education spending below. There are 34 districts that have an increase of more than 6%. And you can see what the range is there. I mean, so it doesn't really tell you a whole lot. I think that probably in a future iteration of this presentation, we'll bring back more detail so you can kind of see the trend in graphic form.
Are the 12 part of the 14 and the 34 part of the 38?
Yes.
Of the, say 38 then, with increased ed spending and overall budgets, are those all past budgets? Like they passed the voters, they approved?
I will double check, but it is the full projection. So some of them, actually, it will include failed budgets.
It will, yeah.
So that this again will change once those budgets change.
And one thing I want us to be cautious of is when budgets don't pass, that doesn't necessarily mean that the next warrant budget's going to be lower. I know that there's some pretty serious conversations happening about rewarning the exact same budget and just having a different conversation with voters. So
That happened to Mary.
did you vote?
Okay. I'll go back and just validate that they're in the same groups. So I'm going to say yes, but I'll make sure. So then just getting into education spending, you saw this last time. So there were 14 districts that had an average decrease of 3.7%. You can see the range there in spending. And then there were 38 districts that were above 6%. There's a little bit of a typo there. It should be 4569684. And so I did reach out to this district on the upper end of its range because there was a question last time in terms of, you know, what that is. So of that, you know, 4.5, almost 4.6 million. In fact, there was a large bond, $2.3 million bond that was associated with that. So that would put them in a different spot within the range if there weren't sort of a one-time. They do anticipate that will carry, but then clear in 28. So within the next budget cycle, you'll probably see that higher budget, you know, change, and it'll be just more operating and personnel expenses rather than a one-time cost associated with that one. So moving down into sort of the district by size and long-term weighted ADM, the last time I did share sort of the budgets within range here. And I can do that again if you'd like, but I also did pull sort of the education spending so that you could see, or here, I didn't show it here, but just for comparison's sake. So in this first budget, these are compared based on education spending. But if you were to take the long-term weighted ADM of 100.5 and below. Education spending is at 8.5% on average. Whereas if you took a look at the total ed spend, it was at 3.5%. And so just moving through the bullets, and again, I'm happy to provide ranges of budgets here, but I'm not going to do that today unless if you'd like me to.
That small category of districts with 100 and fewer students, long-term weighted ADM, what proportion of them tuition at some or all levels?
That is an excellent question. I will come back.
Wondering which one's at the high end?
I know the high end.
I guess I just didn't hear your whole question. Can you?
I just want to know of the smallest districts up here.
Smallest district. Thank you.
Smallest.
Okay.
I will definitely. Great, good questions. Lots to come back with to talk about. So appreciate that. So just the next bullet, and I also should note that within this first bullet, there are 11 districts. The second bullet has 62 districts. You get 3.6% on average increase in education spending. If you took a look at the education total expense, it was at 3.8%. So closer than sort of the previous bucket. And then moving on to this third bullet, there are 23 districts here. And you can see that there is the increase of 4.2%. And the education spending in this bullet is at 5.1%. Actually, here, this is 5.1%, 4.5 in this bucket. And then moving on to the next one. There is, right, 4.2. They're about, and then 3.3 in this bullet here. And then the last one is at 3.9 and 3.3% of education spending. And there are 12 districts within each of those last two bullets respectively. So I'm happy to show this detail a different way or graphically, just so that it's not.
Even just a table that had the one column was the long-term weighted ADM range and one column was the average increase and then one column was the percentage change and the last column was the number of districts in
Yeah.
that range.
Much better, yeah.
That would be easier for my brains.
Yes, I can definitely bring that back in that form.
It would also be interesting to, I don't know. The first one, I'd be curious to know how many in each bucket have tuitioning at some or all levels as a
Okay.
portion, but I would also be curious to know if there's any way to look at demographics, particularly if you're breaking out spending and weighted spending separately.
Okay. Thank you.
Thank you.
So this next chart is focused on education spending. We do have something similar for total education budgets, but just focusing on the spending. This is percent change in spending compared to percent change in per pupil or long-term weighted ADM. So the blue line is the education spending, and then the orange lines are the per pupil. And so you can kind of see, how things look in that way. So moving on, we have the same chart in here for just the failed budgets, just to kind of show you where they show up within the whole scheme of the districts. And so that the bulk of them are in this middle column here. And then just getting sort of on into our tables that we've been presenting week over week. So this first table or second table now is just showing where the budgeted expenditures stack up year over year. So it's 3.59% increase. The offsetting revenues is below 1%, and then the education spending is at 4.15. And those do not include the projected budgets at this time. And the second or third table, you can see, what that looks like with the projections in there. And then this fourth table provides the details of the failed budgets. You'll note that only 2 were highlighted, 3 were highlighted last time, so we at least got one of those budgets in to kind of book, even though it'll change. And then you can kind of see some of the changes year over year, especially in the long-term weighted ADM column. Representative Olvin?
Can you help me understand what's in that last column? Because it has what looks like pretty much the same header as the table 5 last column, but their numbers are very different.
So it's the way they're sorted. So this is the percent change in long-term weighted ADM, and scrolling down to take a look at this table. These are a little bit different. What I was trying to show in this table was just taking the random sample of the failed budgets just to show an understanding of the change in education spending and the change in long-term weighted ADM. So just, sort of demonstrating that there is an increase in education spending, but then generally a decrease in long-term weighted ADM, which is, what we were seeing.
I'm so thick. I did not understand
No,
that. It has almost identical titles. One is percent change in long-term weighted ADM and one is long-term weighted ADM percent change. I'm trying to understand.
Yep,
And
and
just give a definition of each of those so I understand why they're different.
yes. So I think what I was trying to show here is the change in long-term weighted ADM, and that's what we're seeing up here. I think there was a carryover here. I'll look at the back end data for this one just to clarify. But what I was really trying to do was show the changes in long-term weighted ADM year over year.
I think recognizing my ballot language from the various school district, this table for the change in spending per long-term weighted ADM,
Yes.
and then the second table is the percent change in the long-term weighted ADM itself.
Yes, yeah, thank you for saying me. I appreciate that.
It was
Because like I know
it was too coincidental for them both to be.
yes, there was an intention here, and then this table was much larger, and then I shrunk it down to,
I just trying to figure out because we're using the same headers and that makes sense.
so just trying to provide a little bit more detail in terms of, what those budgets look like. And then the purpose of this table, this last table, is really just to show kind of, the changes in spending versus the long-term weighted ADM percentages.
And where it says change in long-term weighted ADM in the second to last column,
So these are the actual counts.
Okay, that's what it
From
is.
weighted ADM. Representative Brannigan had asked in the last session about her home district, and I just wanted to show the number. So there's a change of 37.
I was scanning through that recently and some of the percentages that were very striking to me were also, 10 sometimes. And so it's helpful to see them next to each other. Thank you. Yeah.
I think that's a really important observation. The reason I'm perseverating up there is it has between 3,500, 3,700 students, but it's got a 1-year change of 260, basically, to long-term weighted ADM. And I think the premise of the larger districts has been that it would provide stability, and this just seems to fly against that. And I'm just curious about if there's must be an explanation for why this district lost 262 kids in 1 year in long-term weighted ADM, but it would be helpful to know just as we think about our conversations. It seems like a very large 1 year. And I noticed Winooski was another one that had big year-to-year swings.
Mhm.
It looked like they were high, then they were low, and then they bounced back to where they've been the previous year in terms of total count. So it's just curious to figure out what's causing those big swings and what we think of as bigger districts.
Makes sense.
Thank you. Go ahead. 2 questions. They go in different directions, perhaps. One is Representative Holcomb asked a few minutes ago about which school's tuition. And it would be good to know that because it may give us contrary for
We have
different answers, a different perspective. And I'm just curious about that. And then the other one is rural versus urban. Which is, there's a lot of discussion now about rural schools. And we can assume, first cut is that they're generally small. But I don't know for sure. I mean, I could, someone could go down the list, could check small, not small.
Yep.
I'm just curious to know how that, lays out.
Okay.
If there's a way to do that easily or relatively, but tuition also, some small schools end up small towns tuition and others don't. And you don't have in front of us enough information about the cost.
Happy to bring it back. Sounds like Ted and I have our
Make your life more interesting.
I want to caution, if we have that information on the table, the rural urban thing, I think we have to get clear on how we're defining those two terms.
It's an
but
open fuzzy question.
Yeah, which is, if you're putting open fuzzy questions into tables, open fuzzy answers come that we think are definitive. Which brings me to it's very easy to draw conclusions from scanning a table and thinking that there is something statistically significant there, thinking that there's a definitive conclusion there. And I just sort of caution us to be careful. I think scanning the table helps us understand what questions we want answers to. I don't think it provides us answers.
That's good.
Yes, thank you.
That's right.
Representative Burkhardt.
One thing that might be helpful is, and I know we're trying to simplify, but adding a column or two, that sort of says this change in long-term weighted ADM, how much of it is change in actual students and how much of it is change in the weights of those students? Because that's what I've been hearing anecdotally from districts in my area, that especially when it comes to certifying whether kids are considered to be in low-income households has become more complicated since we went to universal school meals. And I know that we've had testimony that shouldn't be a problem, that there's a certification process that can be done outside of that. But I didn't get a clear answer from the two business offices that I work most closely with. I think they could probably use help in laying out how much is change in seated students and how much is change in weights and which weights we're seeing those trends in. And probably not just for the failed budgets, because there were a lot of budgets that passed that just barely passed and has some of these same issues of big swings in long-term weighted ADM driving part of that, because you're seeing your ed spending per pupil go up, which of course then makes your cash go up. So.
And we did ask Rosie and the school nutrition team when they were in about how sort of the impact on changes in Medicaid are going to affect the direct certification process. Because I think there's sort of places where there might be errors, but there's also places where all of the ways that we are counting students might be changing because of federal changes. We need to move to a new agenda item fairly soon. So just want to flag that for folks and Representative.
I appreciate this, and I think that's part of my request. It's just that there's a lot changing right now, and if we don't have the information, I'm really curious to see the weights for tuition students, for example, because if we don't know what that information is, I don't know how we anticipate and plan for a transition. So that I think that's why you're getting all the questions in terms of the variability, whatever the bounds. It worries me more when it goes against what we'd expect. So when you see, for example, Springfield and Barry having huge declines in long-term weighted ADM, when we know that we're phasing in, I would expect my district to be losing tax capacity. I don't expect Barry and Springfield. So that's where I just want to make sure we're being careful with those children.
And I don't know what I don't know what to expect with Barry. Like, I know that Montpelier has gotten really expensive and a lot of folks who might have previously lived in Montpelier have moved to Barry. And so Barry is, I don't want to use the G word for it, but like, incomes might be going up in Barry, and that is,
But to the extent that declines in weights in historically higher challenged communities are declining, I think we want to do due diligence. We just want to make sure that we know what we're doing.
And even with those incomes coming up, we have lost there are a lot of folks who called it after the second flood. Sorry, there are a lot of folks who called it in terms of living in Barry after the second flood. and said this just isn't worth it anymore. And there are folks being priced out. So I would not, even if the average income of folks in Barry is going up, I would not be surprised to find that the overall population have gone down. And I know that early college numbers in Barry have increased as well.
And Springfield is another higher challenge community, which is a little farther away and I don't think has had flooding.
Right,
So,
right.
you know, again, that's another one where we want to
Yeah,
look.
yeah.
That's all.
Oh yeah, definitely Warren's more effective.
Kelly, do you have any final thoughts for us?
Thank you for all your questions. This is, really what, I think Ted and I were hoping for, so that we can bring back useful information. And so as we get on, bringing it into focus for you and also bringing back things that you can kind of sink your teeth into. So I really, really appreciate it. Thank you.
Thank you so much.
So we're not gonna go right from school budgets update to the yield bill today because of schedules. And so we're gonna move to H 558, an act relating to Medicaid school-based services program. We took testimony on this a few times, including from school business officials and the Agency of Human Services. Last we were together, we were talking about an amendment, which I've asked Jen Kirby to draft. And so she's going to share that amendment with us. I don't even remember if you walked through the original bill with us, Jen. You did great. Okay, great. Look at us on it. Okay, so Jen's going to share the amendment with us, and then Morgan Daybell, who is a member of the school business officials, but from a more rural district, is going to join us as well.
Good afternoon, Jen Carby from the Office of Legislative Counsel. So I will put this language up. It was posted on your webpage, and it is draft 1.6. Lots of various versions going around. So this is a strike all amendment to H 558, an act relating to the Medicaid school-based services program. This would add a new section 1 that's amending an existing statute on definitions in the Medicaid chapter in Title 33. That would add a definition of supervisory union and say that it has the same meaning as in 16 VSA section 11, so same meaning as in the education title, and includes a supervisory district. The definition at the beginning of Title 16 says it includes a supervisory district and when the circumstances clearly intend so or something. So I'm making it clear. Then we have what was section 1 becomes section 1A. We're still in the Medicaid context here, Medicaid chapter. This is the language we've looked at before on the Medicaid school-based services program, giving it legislative intent that the state maximize its receipt of federal reimbursement for medically related services provided to students who are eligible for Medicaid, and also that Vermont school-based medical assistance program comply with all federal Medicaid requirements, making the Agency of Human Services as the state Medicaid agency solely responsible for determining and maintaining program compliance. Then in subsection B, this takes out one of the subdivisions, so it just becomes one sentence. The Agency of Education shall be responsible for coordination of the school-based medical assistance program with statewide education policy and objectives and for communicating with supervisory unions. And this would strike the language saying that the agency may specify the use of program funds received by state education agencies. And you'll see some changes in that statute that is cross-referenced there. So that would come out, and the role of the Agency of Education would be coordinating the school-based medical assistance program with statewide education policy and objectives and communication with supervisory unions. Then it would direct the Agency of Human Services to adopt rules to identify the services that are available through the program and set the requirements for supervisory union participation. And a bunch of things in the language we've looked at before that would be included as far as state and federal requirements in the rules around Medicaid reimbursement. This would add in as a request from the Agency of Human Services, participation in a random moment time study, is a term of art, and an electronic health record system And then continuing on with Medicaid cost reports, provider enrollment and trainings, service documentation, Medicaid eligibility, and anything else needed for compliance with the Medicaid program. Then in the bill, as you've seen it before, the Agency of Human Services would support supervisory unions by funding and providing the technical elements of the program needed for federal compliance. And this would add language requiring supervisory unions delivering medically related services under this program to participate in a random moment time study and an electronic health record system as directed by the Agency of Human Services to enable Medicaid billing of direct health services and Medicaid administrative claiming activities. This was language requested by the Agency of Human Services. Section 2 does not make any changes to the school-based Medicaid reimbursement fund, I don't believe. So it's still established as a special fund. Actually, it's moved over from Title 16 to receive federal reimbursements for medically related services delivered under the Medicaid school-based services program. And money that the state receives pursuant to this section would get transferred into the fund to be administered by the Agency of Human Services. This would direct the Department of Vermont Health Access to pay 55% of the federal reimbursement monies generated by the services delivered in each supervisory union under the program to that supervisory union based on Medicaid cost reports, service claims, and Medicaid administrative costs, and then submitted by the supervisory union. And here up to 25%, and you'll see a new section coming up afterward that modifies that. But to start, up to 25% of the federal reimbursement monies generated by the services delivered pursuant to this program would be available for the administrative costs of agencies of education and human services related to collection, operations, and reporting of the programs. Requires the agencies to enter into an MOU, setting forth the processes by which the Medicaid reimbursement monies for administrative costs and statewide programs are allocated to each of the agencies. It allows the secretaries to expend monies from the fund only as appropriated by the General Assembly, and any remaining funds at the close of each fiscal year would get deposited into or transferred and deposited into the education fund. Section 3 is a new section. This would amend that 25% of funds that go into, that would be going into the fund and available for the administrative costs of the agencies. This would reduce that percentage to be up to 20% starting in calendar year, 2027, so fiscal year 2028. Section 4 makes some changes in the Title 16 provision. So this is where the special fund and use of funds currently lives. And this takes out a lot of the language and just leaves it with legislative intent. So it has similar language as far as stating intent of the General Assembly that the state maximize its receipt of federal reimbursement for medically related services provided to students who are eligible for Medicare. And it is further the intent of the General Assembly that each supervisory union identify special education and other students eligible for Medicaid reimbursement, and to the extent possible, submit Medicaid compliant cost reports and service claims, and that the agencies of education and human services work with local school districts to maximize reimbursements, including services to non-IEP students. And the rest of this would be struck, including language that was not struck in the bill as it came over from House Healthcare, directing how supervisory unions would use funds received under this section. And under current law, it says they can use them to pay for the reasonable costs of administering the Medicaid claims process. And school districts and supervisory unions must use the funds for prevention and intervention programs in pre-K through grade 12. And then the bill was going to add some language, and instead this provision would just come out. Along with adopting rules, there's really nothing to adopt rules on here if you're not dictating how they are using the funds.
The idea being, just to add some context for folks, there are a lot of rules for what can be billed in the first place. And so there's no need to sort of control it on both ends. It's already been tightly controlled.
All right, section 5 would require some stakeholder engagement and implementation. This would require the Agency of Human Services to collaborate with the Agency of Education, the Vermont Association of School Business Officials, the Vermont Council of Special Education Administrators, and school district officials in implementing changes to the Medicaid School-Based Services Program in accordance with this act, including both providing structured opportunities for input during the phased implementation process in order to address challenges and risks in a timely manner and minimize disruptions. Also focusing on geographic diversity to ensure that the implementation process is responsive to regional variations in needs and capacity. This would move the effective date from July 1st to October 1st, which had been, I believe, the request from the agencies, except that reduction in the percentage of reimbursement monies available to the agencies would take effect on July 1st, 2027.
When piece that sort of the amendment that is not, that isn't in here, that I'm trying to figure out, Jen's trying to figure out, Rebecca's trying to figure out, is sort of all of the conversations that we've had with the agency, that VASBO's had with the agency of Human Services, not AOE, is that this will be more money coming down from Medicaid than under current law. And cannot figure out exactly what that is yet because there's a lot of work to do to get there. Would like to put in some reassurance that it will not be less money. We can put that in intent language, but we want to make sure that we aren't running afoul of federal Medicaid rules by putting it in statute. And so Jen's looking into that. We might need to have that get finished in the appropriations committee. They're going to need some time with this. So that's sort of so we could put it in intent now and not have it have teeth and ask appropriations to have it be finalized and sort of send them that sentence. They're going to need to do a little bit of work on the bill anyway in order to have all of the numbers shake out and match up with the budget. So that's a question on the table that I hope we can figure out before we're done with this today. Does anyone have any questions for Jen about the language? Yeah.
I'm still very concerned about this bill, really, just because we have a terrible track record of implementation of complex change. And at the same time, I realize it's important, it has to happen. One of the things that it still doesn't do is address, or at least consider, a phased implementation. And I don't know if that's because of the urgency of the transition, but one of the advantages of doing it in a phased way, it lets a smaller group of districts troubleshoot before you try to push to scale, including into districts that may have less capacity. And that I don't see that here. I appreciate what the chair is saying. I think there's a couple concerns around the fact that this is more work for school districts, possibly, potentially. And also it's assuming that they will pick up revenue from non-IEP services, and that will cover whatever may happen on the IEP side. It may end up coming out positive for districts financially, but we don't know that assurance. And particularly given that there's such a tight timeline for the rules, but there's no tight timeline for any of those other Medicaid and non-IEP related services. It's an exercise of faith. And I just, given our propensity to mandate very rapid change without attention to all the other things that we're asking, I'm extremely concerned about this.
Is there something else you would like to change in the language in order to have more assurances?
I think I recommended phased. I think increasing the percentage for school districts potentially, because if this really is going to be more revenue, we should be able to do that and still hold AHS harmless.
So this is increasing the percentage I want to take this one at a time to make sure we're working through it. So this is increasing the percentage for school districts.
I would bump it to 60. If it really is going to do what AHS says it's going to do, there should be more capacity. And then the
I just want to catch up with what you're saying. So asking you to slow down. So the first thing you said about a phased approach. So AHS said they were doing a phased approach when they told us about this in testimony. That's how it's described in the presentation.
And we did add some language around input during the phased implementation to address challenges and risks in a timely manner.
Is there more language you'd like to add to address
The
that?
reason I was trying to put a phased approach into statute is I'm not sure collaboration to them looks like collaboration to everybody. We were told also that they've been collaborating with districts about how this would roll out, what services were involved. And what we heard after the fact is that districts have had a chance for some of them to preview the platform. That is not collaboration on an implementation plan. So my point is, if we really are worried about a high stakes transition on a very consequential program, people really need to pay attention to implementation science. And I don't see that in here. I just don't. And so that putting in a phased approach is a chance to, just really say, we're very serious. You need to run this through with a subset of districts and figure out if it's going to work and make adjustments before you go forward. Because what we don't want to do is rush it, right as we're trying to rush through all this other stuff.
Jen, can you bring up the language about the phased approach?
Okay, so then maybe that's it. I'm just very worried about this program.
Okay.
And then I would love to see attention to the piece that you're talking about, that you mentioned, that you're saying now maybe worked on an appropriation.
So do we want to, so I think the question is,
It's just,
I just want to, so getting a fellow of CMS is like definitely not the thing to do in this moment in history. And so I'm wondering is,
100% agree.
so what I'm wondering is, do we want to put in an intent language? Or do we want to just ask appropriations to add in this language, add in more definitive language when we can get more feedback from AHS on this?
I think we need to get feedback from AHS.
So you want to ask appropriations to do that?
However we
Okay.
do it.
Okay.
We do it. I think my point is, I'm not saying we should put bad language that hasn't been vetted in here now. That's not what I'm saying. I'm just saying we have to take this seriously because falling afoul of CMS can happen in two places. It can happen at AHS. It can also happen in the field.
Yep.
And if we don't pay attention to implementation, we will fall afoul in the field.
Anyone have any other questions? Any questions for Deb? Yes.
I just want to say, I was very concerned about this the other day.
Mhm.
Fell apart when I just thought, when the FASBO came and I just said, oh my goodness. And then I asked some questions. And so between what you're asking to, make some adjustments with and what I was able to ascertain, I feel that going forward with this would be appropriate. And I don't know, I hope that maybe informally, we can ask House Appropriations to let us know how it's going.
Yeah, we could even ask them formally. I mean,
Or
like with with a email or something, like more like, an email rather than.
Not
Yes,
in law.
absolutely. Thank you. That sounds good.
And even if we ask them, they may find out something from CMS and we don't get what we're hoping for. And I'm just saying, I am very concerned with the sheer volume of transition we're imposing right now and the very high level of potential risk that comes with that. And so I just want to make sure that this is critically important. It involves huge amounts of money and we need to do it right.
Yeah, agreed.
I just want to know what's done can be undone. So
Not
be aware,
always,
everybody.
not always.
It is, I think history is telling us anything, so it's easier to break something than put something back.
That is the point.
So thank you very much, Jen. I appreciate that. If you could remove the highlighting, I think that would be great.
Yes.
Okay, and we're gonna hear from Morgan about,
I'm actively trying to get an answer.
I know everyone's doing the best. I know they are.
thank you. Hi, Morgan. It's nice to see you. It's been a really long time.
It's nice to be back.
I'm sure you really missed us.
Thank you for having me. For the record, Morgan Daybell, I'm the CFO for Franklin Northeast Supervisory Union. We are a union of two districts nestled up against the Canadian border. I know that you heard from Heather Bushy and Nicole Lee last week, and I am happy to see that with the amendment that you just went over, that has largely addressed the concerns that they brought up. So I'm thankful for that. I will also add, it's a theme that you've just been discussing, that there is certainly a lot of agita around this in the field as well. We in addition to what had been brought up, and I know Heather spoke about the challenges of a billing software change from her experience. Want to put on the table that the AOE folks on the Medicaid side are it's some of the easiest interactions we have at AOE. That's a really smooth working relationship there. So I think people are worried about losing that in addition to the timeline of the change and what we think is going to be a big lift in terms of training up our staff. And we do appreciate the increase to 55%. We would be happy to support Rebecca Holcomb in giving us more, not only that it has more coming into the district, but less kind of going into that big ed fund bucket, which is an easy target in some years is also appreciated. And I think that you had some questions about the program with rural districts perspective. So I'm just happy to take those if they're still on the table and do my best to answer that.
Yeah,
I think that part of that came from me, and it wasn't actually so much about rurality as there's differential capacity, for example, of designated agencies, for example, to support some of these needs in different parts of the state that may not be a function of rurality, but maybe a function of something else. And I also know that there's been a change from bundled rates to bundled services and a change in how people contract with DAs in some regions. And I wondered how those changes were going to feed in or interact with this transition as well. I don't know if that's an experience you have in your region.
Yeah, I can't speak to the second part. Certainly, we have had struggles with the designated agency, and I think it's largely a struggle up here just in terms of personnel capacity. So we know that we're all having trouble hiring folks, and in the past, we'd often been, poaching staff back and forth between the education and the mental health agencies. And it's a pretty limited pool that we are working with up here. So I think that's certainly a bigger challenge than the Medicaid program. That's really a structural challenge for Vermont.
Yeah, I mean, that staff poaching back and forth between the two happens in my region when we have a much sort of wider multi-state employment pool even.
Right.
Yeah, I don't disagree. I think that when you when you systematically underfund designated agencies, you create a shift into school districts. And when you are simultaneously in some regions, and there is some correlation between school-based Medicaid and poverty level of districts, and we are also increasing the weighting and the funding available, you're also creating an incentive to pull all of those services into school districts. That may be good for kids. It may not actually be good for the state. And I think that's my concern, actually.
And I know that the healthcare committee took some testimony on that last year, and I don't know how much more they've taken this year. It might be worthwhile for someone to spend some time talking to them about it. Yes, Representative Lee. And I want us to focus ourselves on Morgan while Morgan is here.
So I understand if a school district is serving those needs, they serve the child only. But if it's a designated agency, they can work also with the family. Is my understanding correct?
I think that's the theory, but I think where you have weaknesses in the system overall, we are let's say the building of last resort. We're the ones that are not going to turn those students away. So we are focusing on a lot more than school and the school day with some of these kiddos.
So would you say that this is exactly one of the reasons why school spending seems to be going up?
It has certainly been an impact in our district. Yeah.
And when we took testimony about that sort of comprehensively last year, the year before, that was like definitely one of the big, it was sort of the post-COVID, one of the big drivers. Yeah, no, thank you. Morgan, so can you summarize your remarks in closing for us?
Yes.
Seeing that I have no other questions.
Sure. I will say that the reason for the change here is way above my pay grade, so I don't want to wander into that. I appreciate the changes with this amendment. And keep your eye on making the transition as smooth as possible, because it is a big deal for us and it is a not insignificant part of our budgets.
Thank you very much for your time today. I really appreciate it. It's nice to
Sure
see you.
thing.
Leah, are you able to share some sentences about the fiscal impact of this?
Sure.
Good afternoon, Julie Richter, JFO. So there aren't any documents about this on the committee page under my name. Just wanted to share that we, JFO, myself, and a number of my other colleagues have been in close communication with both AOE and AHS to understand the overall fiscal implications. I would say that the primary implications from our understanding is really from the budgetary perspective, in which because this program will be moving into AHS, but the Medicaid dollars are being used within AOE's budget. At the moment, there needs to be some accounting shifts from the budget perspective in order to ensure that both AHS and AOE remain whole following this change. So I would say from that perspective, in the very short term, it appears to have a de minimis impact at the overall picture to the budget. As to if additional funds may be able to come in from this change in the random moment time study, I defer to AHS on that. That wouldn't be happening in FY27, so we wouldn't be booking any of those additional revenues to the education fund. I guess I would say the final piece, which gets to the Medicaid monies going back to school districts, the stronger the parameters that exist around those monies going back to school districts, the stricter the use of those funds and how they can or cannot be used within the district's budget. So it's just something to keep in mind. Happy to answer any questions if anyone has any.
Julie Richter record. Thank you.
Get this
Um,
one.
do-
Get this one.
Representative O'Neill.
I'm sorry, as I'm looking back at my notes, I'm a little confused. Representative Holcomb said better to have it be a greater percentage, maybe up to 60%. And our last witness said, oh, he likes that idea. Where is the rest of the percentage going to HHS if they're administering the program?
So that's probably a good question for Jen. It's some of it's going to, she can and maybe come back. So some of it's going to HHS for administrative. That's why there's a sort of a 1-year delay in the implementation of the percentage changes. And then some of it's going directly to the ed fund and some of it's going directly to districts.
And Jen Carvey, Legislative Council. Yes.
So one other thing I would say as you're sort of pulling it up, Jen, is that what we're seeing here is a pretty significant, it's an increase in how much is going to districts
Right.
Over current law. It's just not as,
Is it 5%?
well, that's what we'll.
Sort of. Jen Carvey, Legislative Council, 55% would go back to the districts, up to 25% for the first year, and then going down to 20% would be available to agencies of education and human services related to administering, collecting, operating, and reporting on the program. And then any balance would go into the education fund on an annual basis. In the existing statute, this is why I said sort of, under existing law, you can see it crossed out. The supervisory unions get 50% of the funds, not the 55%. And then there's a whole additional amounts. If they exceed $25 million, then some of that can go elsewhere. And it's a bit more complicated in current law, so I'm not sure it's as easy to say it just goes from 50 to 55, but it goes to 55 for the districts, 25, and then 20% will be will be available for the administering agencies, state agencies, and then the unspent amount of, so was that 75 to 80%, depending on the year. So 20 to 25%, I think automatically goes to the ed fund, and anything unspent from the agencies, the state agencies, up to administrative percentage would also go into the ed fund.
I guess I'm concerned about the ed fund getting so much. I mean, this is actually I would think it's supposed to really be targeted to the children who need the services, to the schools who are providing the services. So, and I can see that you have to have some administrative costs. So I don't know if this is a reasonable amount compared to other states or not, or compared to what
So-
here, I just don't know how to compare those administrative costs to what they could be. And I don't know why Andy has to go into the education.
For the AHS administrative question, I'll say that is sort of the minimum amount that they feel comfortable with. That's, they're just starting to administer this, but, and that also is sort of more of an appropriations is good at shaking that part out. For the split between the ed fund and the districts, I'm gonna have Julia jump in. Yes, please.
Julie Raker, not at all. Julie Raker, under current law, there is a portion that is going directly to the education fund. So if you look at the education fund outlook, you literally see a line in the sources section that says, I don't remember what it says verbatim, but Medicaid reimbursement or something. And that's that share that's automatically going to the education fund. The other portion that's going to districts, you could also think of as going to the education fund because it's reducing the amount that the school district needs to draw directly from the statewide education fund. So I would say it's really a question as to, under current law, how those Medicaid dollars are impacting the local district's tax rate rather than where they're going strictly from accounting perspective. It's how the Medicaid dollars are going to districts and how that filters through.
Well, I said,
It's row 7.
I'm very happy to have people disabuse me of this notion. I don't really like this so much going to the ed fund. It's supposed to be to help the children and in the district where they live, or supervisory union where they live. Put it into the ed fund, then we use it in the end. Does that eventually just drop down to extra money and then we use that to lower property taxes?
Yeah, so the Medicaid transfer, which is that I don't recall if it's being changed in the language, the Medicaid transfer to the education fund.
It's just the sweeping. I mean, I have Ashley's slide, if that's helpful to put up
I have
about,
that open too.
well, I mean, for them.
Okay.
I don't know if that's helpful to show. I think it's not a big change. Some of it's not a big change from the way it works under current law.
I'm uncomfortable with this.
So I guess what I want to offer is, given that the administration of this is the ability to administer this is very, very different from district to district right now, both just like under current practice. And they are working to, like, part of this is about really reducing the friction for districts and making it easier. Under current law, I don't think it would be fair to essentially send all of the Medicaid dollars we're able to pull down to districts just based on really how well they can manage the paperwork side of this. As this is implemented better, I think that would be a very different conversation because we could create more equity in how it's spent. The money is spent regardless. This is for the good of the kids.
Well, maybe then.
And so in a future year, I would love to pick it up.
Maybe what I might suggest is that the amount over the next 4 years or 5 years that goes into this, into the Medicaid reimbursement line decreases each of those years so that at the end of a certain number of years, it's all, except for the administration, going into the schools.
So no matter how, if it goes to the schools directly or it goes to the ed fund, it's still going to.
Yeah.
Okay.
I hear you, except
Okay.
not really.
No,
Because
really.
if you had, yes and no, if you have 100% of your kids are eligible for Medicaid, but you don't get 100% of what you could be getting, and in another district, it's a made-up district, 0% goes to kids qualify for Medicaid, then everyone is helped. Everyone takes advantage of that extra, I say slush fund that falls down into that line, and gets used in the, by the ed fund to lower taxes. I think that the reason I would think that we would have that money is to directly give services to those kids. We're losing a lot. We're losing, I'm not telling you, I'm saying, the more I'm thinking about this, the more I'm thinking that it's money to administer. Maybe we should have in this law a declining percentage. And maybe we have an increasing percentage that goes to the schools and doesn't go into that line. And that, if I would like to solve the problem, I would say, can we put that language in here? Then people can always come back to us and tell us how this is impossible. But if we have the expectation, it's more likely to be met, and the funds will more likely to be going to where the need is.
I'm feeling very like final hour, we need to move the bill as air traffic controller right now. I'm just like naming where I'm like, how I'm showing up in this
It doesn't take
conversation.
that long to
No,
do
I'm
this.
just saying where I'm coming from.
All right.
And that this is all very new and a lot of transition. And so doing something like that next year or the year after might make more sense once we actually have any idea how much money we're talking about. But I don't,
I
yeah,
just,
I felt like it was risky that we were even changing the percentages at all, given that we're not sure how much the new we're gonna be able to draw down. Representative
to me,
Holcomb?
this is just one last, to me, this isn't about the percentages of them or anything. It's about the main overarching, what's your vision and mission here? And if your vision and mission is to get the money to the kids who qualify, then I think this is not right.
So the kids who qualify get the money regardless. It's whether it's how the reimbursements are going back to districts afterwards.
Yes.
Okay,
That's a big deal.
yes, yes. Representative Holcomb?
I'm comfortable with waiting. The reason I had suggested bumping up, at least in the transition to 60, is because this is a lot of work. I mean, there's a lot of retraining and it can always be revisited. And the challenge, there's two challenges that I see. One is we don't know what's coming out of House Ed, but some of the things they've been talking about might support regional shared services. This is a case study and the kind of thing that ought to be done regionally and not at a local district level. And we just don't have that receivership for it currently, but we may have it in a little bit. The other piece is that I think the challenge around this is if it's not in districts' interest to bill for Medicaid, they just won't do it. I mean, I sat there, we ran the numbers, and was it cheaper to try to get Medicaid reimbursement or cheaper just to hire, do it in-house? And they will make that financial.
Do they stop its percentages?
They pay attention to all of this, and I think we don't know, the problem we have is we don't know the regime we're going into. Because we don't even know what services are really eligible, so we don't even know what that's gonna look like. And so I think what I hear the chair saying is, we know we're gonna have to visit this. And maybe what we need to do is start the transition and then see what those services are and we'll have a better sense. If we can bill back for all kinds of non-IEP related services, we could have more money than we have currently.
And I think we're imagining we're gonna have more money, and I think at the point we realize that we have more money, then changing those percentages makes sense, but we also don't want to increase. This is, I don't think, a year that we're looking to reduce the amount of revenue going into the education fund either.
But
I just.
and my question is it a year to slightly increase it? Because as you know, we are driving up education. This bill will increase education spending. It just will.
Increase.
It will, it has to, because they're gonna have to hire someone to support this transition. Somebody has to do this work. Everything we do costs money.
Representative Maslin.
Thank you.
Jen, you don't have to sit there. I'm so sorry, I did that better.
Maybe I didn't sleep well or had a bad weekend or something. I'm following the witnesses on, the representatives on your side of the table very clearly. But at the end of each section or something, I'm still unclear why we're doing this.
Oh, the whole bill.
This section or 7 sections or something like that, I can follow, I can see more money for kids. I can see costs going here and there and who gets reimbursed, who doesn't, what's the benefit at the end of the hour?
The benefit is that it should significantly reduce the friction for Medicaid billing for districts, which is
Okay.
very high right now.
Yeah.
And should be able to draw down much more federal Medicaid dollars when it's implemented. And
So we can do it
should
if-
also increase our compliance,
That makes
our ability to
sense.
compliance. Yes, it
Thank
does.
you. I get it.
So Representative Odie, are you,
Of course, I'm gonna support this.
okay,
However, it's not my favorite. And I prefer to have something built in here with
I would too.
percentages language, because it will force them to come to us, whoever they are, and say, oh, this is, can you help us? But leaving it like this, now it's, to me, just easy money falling to the bottom line, and I don't appreciate it.
I think it's still hard money falling to the bottom line, but I hear what you're saying.
Hard money
Appreciate
falling to
that.
the bottom line.
So what I would like to do in an ideal world, if the committee is happy and willing to do this, is we move this bill as amended. And we work on a few things that we're asking the appropriations committee to put a little more tightening around. How does that sound?
I'd like to see it again, though. I mean, not now. I mean, in future,
Yes,
a future legislature, I'd like.
I think we are
Future
absolutely gonna need to,
committee.
yes, we will absolutely need to continue to check back on this and monitor it very much. Yeah. Okay.
I can support movement of this. I am not sure. I need to see some work out of appropriations before I know how to vote on the floor. Yeah.
Appreciate that. Representative Maslin.
Yeah, thank you. The last few minutes have been helpful. What would help me, for example, or some other people in the room or outside of the room, is we're gonna do this because, just explain.
Great.
But when we had, bits and pieces from sections from JFO, it wasn't clear. In spite of clear sentences, we're doing this because.
So we have another bill scheduled. I know that Beth needs to be in another committee after she walks us through that other bill. Are folks able to vote on this now, or would you rather wait?
I can vote on it now.
Okay, that great. Okay, can someone make a motion then?
Some of the things.
Madam Chair, I would move that we find H588 favorable as amended. Or amend
We want to amend 558.
50, what did I say?
588.
Yeah.
Excellent.
Let's do that one.
So second, Kelly's motion to amend H558.
Thank you.
Draft.
Draft 2.1. Thank you. So Representative Wozniak. Thank you. Representative Wozniak moves that we amend H 558 with version 2.1. Representative Burkhardt seconded. Any discussion?
Just with great reservation about my idea. Yes, thank you. Great reservation.
You
I would say, can I move forward?
may not. We're amending now.
I understand. It is very difficult for me even to evaluate this without knowing what else we're gonna put on districts for next year. We're still dealing with a law that says we're gonna merge 119 districts into 20-something districts by a year from now. That's absurd. And so like, if we do this and that, we're toast at the state. So then I guess I'm a no.
I don't
It's okay.
remember. I don't remember the discussion like this when we first presented the bill. You know, and I realize that we have amendment. This is all new discussion, isn't it?
Well, it's all been there all the way through.
But it didn't seem though that it came out,
I brought up a reservation the first time, if you.
yeah, but not as strong as.
My first reservation was VASBO coming at that time and being concerned about that.
Okay.
Then I did some work outside the committee and said, all right.
I'm sorry.
And then the second time, then I'm looking at the numbers and saying, oh, okay, wait. And that's what you heard me talk about just now.
And I did hear that vote appreciates the amendment. Okay. Seeing no, yeah.
They also asked for to be very clear, they appreciate the progress, but they did also ask for the kinds of assurances we're asking House appropriations to make, which are not before us at the moment.
Yeah.
So we are voting on something that they didn't say they support. 100%.
Okay, seeing no further discussion, if the clerk could please call the roll.
Representative Brannigan is not here. I will vote yes as Representative Burkhart. Representative Higley,
Yes.
Representative Holcomb,
I'm gonna vote no now, but I may vote for this on the floor if we make those changes.
Representative Kimball is not here. Representative Maslin.
Sure.
Representative Odie,
Yes.
Representative Page,
Yes.
Representative Wazazak, Representative Canfield,
Yes.
Representative Kornheiser.
Yes.
We have voted the amendment favorable, 9-1-2. Math.
8-1-2.
8-1-2, yeah, there you go, 8-1-2.
Madam Chair, I would move that we find 558 as amended.
Thank you. Representative Wazak moves that we find H 558 as amended favorable. Thank you. Representative Canfield seconds. Any discussion? Seeing none, clerk, please call the roll.
Representative Brannigan is absent. I will vote yes as Representative Burkhart. Representative Higley,
Yes.
Representative Holcomb.
No.
Representative Kimball is absent. Representative Maslin.
Yep.
Representative Odie,
Yes.
Representative Page,
Yes.
Representative Wazazak,
Yes.
Representative Canfield.
Yes.
Representative Kornheiser. And we have voted the bill favorable as amended, 8-1-2.
Thank you. I'll report this.
That's a good idea.
Oh, thank you so much, Representative Woody. Okay.
588 was the OPR, so I was ready to.
You were, but thanks so much. Okay, we're going to move to H 931. Represent, St. James, you're not a representative. Would you like to join us in the chair, please? I'm gonna step away for a minute and I'm hoping we can get through all the sections of the bill and then save questions for the end. And really keep a focus on our jurisdiction here, even though we all care about education muchly.
Beth St. James, Office of Legislative Counsel. Do you want me to share my screen?
Yes, please.
Hi, we're going to be walking through H 93 as introduced. This is the committee bill that passed out of House Education last week. It is the miscellaneous education bill. Many pages. There's really only 5 substantive issues. So reader assistance headings are your best friend in this bill. On page 1, line 3, you'll see the first reader assistance heading, approved independent school moratorium. Section 1 amends the moratorium on the approval of new approved independent schools that you all created in 2023 in the budget. you can see subsection A was added in 2023, subsection B was added last year. And this bill proposes to add subsection C. The moratorium in general, in subsection A, says that the state board is prohibited from approving an application for an initial approval in an approved independent school. So they could continue to approve renewal applications for approved independent schools. Subsection C is an exception to this moratorium that states the moratorium shall not apply to changes in ownership of a therapeutic approved independent school. So if submission of an application for initial approval of an approved independent school is required as the result of a change in ownership of a therapeutic approved independent school, that at the time the change in ownership is approved by the state board, it is a therapeutic approved independent school, and then it is going to remain a therapeutic approved independent school after the change in ownership. The moratorium doesn't apply, and the agency and the state board are required to process that initial application according to applicable state and federal law. So this is very specific to approved independent schools where there is a change in ownership that triggers a new initial application to the state board for approval, and the school would remain an approved independent school, a therapeutic approved independent school after that change of ownership.
We have a question from Representative Odie.
Almost have this, so can you just explain it without, just on day one, there's X.
Okay, so day one, you have school A. It is an approved independent school under the state board rules. And it is also it's characterized as a therapeutic approved independent school, which you now have a definition of in statute. Someone comes along and wants to buy school A. The person who comes along and school A reach a mutually agreed upon agreement, and they decide to go through with the sale of the school. Whatever the state board's rules are for an action that triggers a new initial application to the school, I believe in this case, it's because, actually, I don't know. I can theorize that perhaps there is a new LLC created or a new, some business organization is new when this change in ownership occurs. And that on the way that the state board interprets their own rules and state law is they would require this therapeutic approved independent school to submit a new initial application to the state board for approval. The moratorium on approved independent schools in subsection A would prohibit the state board from acting on that application. So even though the parties agree to a sale of the school could not function as an approved independent school, a therapeutic approved independent school in the state, and have that sale go through. So they would have to make a choice. What subsection C does is it says, if you are a therapeutic approved independent school, you have a change in ownership, you intend to remain a therapeutic approved independent school after that change of ownership is completed. If the state board wants a new application, then the moratorium doesn't apply and they have to process the application so that you can be approved, assuming you meet all of the criteria under state and federal law, to be an approved, therapeutic approved independent school.
So is there anything that in the discussion that committee had that where there was any concern about new owners and what a new owner might be seeking when they're running that school versus a current owner?
I don't know that I was in the room for every conversation that happened. They did add, this language did go through a couple iterations. And one of the clauses that House Education added was on page 3, line 2, a requirement that the school remains a therapeutic approved independent school after the change of ownership. So that's the extent to which I can answer your question is that, this language is not contemplating just a change of ownership. And then the school is going to transform into a dressage school.
But I have so are therapeutic schools approved for particular purposes? Because you said you wouldn't turn into a dressage school, but what if it's a therapeutic school for X? Then all of a sudden it becomes a therapeutic school for Y.
I think in state statute, no, and perhaps there is an equine therapy school, and that was a poor choice on my part.
Yeah.
Under state statute, no, I don't know the rules intimately enough to know off the top of my head if there is anything specific in the rules related to different types of approvals like that.
You think that that's something that we should? It seems to me that might be important.
Did you have another question?
No, that's it. I think that might be
Jim.
something.
Representative Maslin.
Sorry. So, how often do these schools change ownership?
I don't know the answer to that question.
I mean, I know
I don't
of
know.
independent schools, we could make one up Middletown or something like that, right? And what I'm thinking about, not by that name, is I know how it functions, and that all makes perfect sense to have it essentially reapply under a different name, if I understand where this would go. That all makes good sense. I'm just curious to know if these schools change ownership periodically. And I mean, given our concerns out and about equity shares here, there, and ever, I'm just curious to know what we might know before we vote on this. Maybe it's not a question for you, Beth, but it's a question that I'd like to understand more about. Need a different witness.
Representative Burkhardt.
So correct me if I'm wrong, Beth, though. This isn't really changing the process by which the state board decides to approve an application. It's just saying that there's this big moratorium we put on new independent schools. This is an exception. They still have to go through this process, and the state board still gets to decide whether this new owner is appropriate, if the therapeutic program is appropriate, all that. So that's where I feel like we're getting a little bit outside of our jurisdiction here, because we're not really changing the whole process for approving a therapeutic school. We're just saying we're making this little exception to this big rule that we made last year in Act 73 about no new independent school. Am I correct?
Yeah, I can't characterize it as big or little. That is for you all to decide. But yes, lines 5 and 6 on page 3 require the state board and the agency to process the application according to applicable state and federal law. So if there's something in the change of ownership and something in that application that would prevent the state board from approving an initial application, regardless of whether there was a change of ownership, then they wouldn't approve the application. This doesn't change anything about whether the board will approve an application. It just changes what applications get through the door to the board. Right now, no one's getting through if it's a new application.
Representative Wozniak.
I appreciate that, Representative Burkhardt. I just want to name for transparency that this language came from a bill that I introduced to the House Education Committee, in which I know there's a circumstance in which there's a woman who's been running an independent school under her business, forever and a day. She wants to retire and get out. And right now, there's no easy way for her to, hand over the reins to somebody new. That school would have to close. And I didn't feel that that was the intent of the overall moratorium on new independent schools, because it's not really new independent school, it's just new management, for lack of a better term. And that new management, as Representative Burkhardt just said, would still have to go through the same process that anyone else who manages one school would have to go through. But it's not a new independent school in that sense.
Representative Holcomb.
Could be a private equity company buying it.
It could be, but again,
Yeah, I mean,
that's still a decision for the state board.
Well, their rules would not prohibit that. I mean, that is where we're headed.
That is my concern right there. And so I appreciate what you're trying to preserve, and I want to prevent what you just brought up.
And I think that's a conversation to Representative Burkhart's point, that's a conversation for rules around the state board, et cetera, not necessarily our.
Because it's actually allowed.
It's House Ed, it's a House Ed issue, not the state.
Okay.
Well, either way, not our bailiwick.
Well, maybe we can write a letter to them about this.
Section 2.
You're not voting.
Section 2. All right, we've got a new reader assistance heading. We're gonna get through this one in record speed. Section 2 is adopting the interstate compact for education. It's all brand new language because in the early 90s, we were a member of the interstate compact for education and then we withdrew. We have not been a member since. This is the education compact for the states who you hear from quite often. This is a compact, the same way that social workers are part of a compact and nurses are part of a compact, right? This is a compact. And so section 2 is quite simply adopting the compact. I think we're one of maybe 2 states that are not members right now. This is the standard compact language for every state that is a member of the compact. It does require an annual fee. The fee is not enumerated, the number of the fee is not enumerated in the compact language itself. My understanding is Vermont has been paying that fee on and off for several years regardless. And you all have been appointing members on and off to the compact for years regardless. So this would be you rejoining. So you would have to pay the fee, but you would have all of the privileges and duties and responsibilities of full members to the compact. And by and large, what the compact spells out in here is that it is a place to discuss, to research, to analyze, to put folks who are involved in education in every state in touch with each other to discuss education-related matters. That is essentially what the compact is.
Let me just ask you, this is all within AOE, it doesn't involve OPR?
No. This does not involve AOE or OPR. With the state itself would be a member of the compact. And there's a provision in here for who I think we appoint, I think they call them commissioners. Yeah. So on page 5, line 1, section 1503. The commission consists of 7 members representing each party state. 1 of the members is the governor. 2 of the members are state legislatures selected by the House and the Senate. And then 4 members appointed by and serving at the pleasure of the governor. And then there's further provisions in here, but I think in the interest of time and your purview, it may not be the most relevant to our discussion, but there is a provision for who gets appointed. So there's no one at the state level who's administering anything. We are just members of the compact. You would have to pay money. So to that extent, there is someone administering money. Are we good? All right, avert your eyes. Another many pages with hopefully something we can breeze over. We're going to jump to page 15, section 3. You can see a new reader assistance heading here, cooperative educational service areas. All section 3 and several of the sections after it do. So everything under this cooperative educational service areas, all these sections do is change anywhere the words boards of cooperative education services are to cooperative educational service areas. And anywhere you see the abbreviation of BOCES, find an example. Anywhere you see an abbreviation for BOCES, we're replacing BOCES with CESA. It is a hotly debated topic of how you pronounce that. I am going with CESA.
And we are not entering that debate. We're just moving through.
CESA.
I agree with that.
That's it. That's all of the sections in this reader assistance heading do. I took the law that you passed to create BOCES in 2024, 3. Found everywhere in the VSAs where there was a mention of BOCES, swapped out the applicable terms and moved on. Shall we all move on now? Please.
I have one question.
Okay.
There are sections in there that mention supervisory union, but not supervisory district as an alternative. Does it matter? Or should I just keep my mouth shut?
I can't wait till you all make changes in the law. No, well. And we don't have to have this. The BOCES chapter starts with the definition section, and in there, it's very, they state that supervisory unions is the same definition as in section 11, which is the master definition section for Title 16, and includes supervisory districts. I mean, I don't have to worry about it.
We did that same thing in 558, which is the bill we were
So good,
working on.
so good.
Almost never do you have to worry about where the word supervisory union is used and whether supervisory districts are also included. Almost never.
Okay.
But I appreciate the concern nonetheless.
Representative Maslin, and then I'm gonna ask us to hold our questions until we're at the end.
Okay, so the responsibility of the CISA,
Mhm.
as we currently understand it, is the post change to the CISA.
Correct.
Thank you.
The only thing that changes is the name.
Thank you. I thought I understood that, just thought I'd ask.
Yep. Okay, avert your eyes once again. Actually. Okay. The penultimate substantive section here is related to class size minimum. So we're on page 33, line 12 is your next reader assistance heading, class size minimums. Last year, you all enacted class size minimums as part of your education quality standards. Those standards go into effect July 1, 2026. You also required the State Board of Education to update the education quality rule series on or before a date that is not July 1, 2026, that comes after July 1, 2026. There has been confusion in the field over how folks are going to know if they are complying with class size minimums without the rules going into effect. That may provide some nuance to maybe some define some terms, etc. So Section 13 amends Section 7 of Act 73, which is a piece of session law regarding failure to comply with class size minimums. Subsection A remains unchanged. This bill adds subsection B, which states that a school's failure to comply with class size minimum requirements shall not count towards the 3 consecutive school years of non-compliance that enables the secretary to recommend action to the state board until the state board adopts updates to the EQS rules to reflect the addition of class size minimums, or July 1, 2027, whichever date shall come first. So the statute still takes effect on July 1, 2026. Class size minimums are still in effect. But whether you are compliant or not cannot be held against you until those rules are in effect or July 1, 2027, whichever comes first. And finally, we are at the section that I believe brought this bill to you. Background checks. Page 34, line 11, background checks. We're adding a brand new section to Title 16 that essentially, I'm just going to summarize it, that requires the Agency of Education to request a criminal record check for a person that the Secretary of Education is prepared to either recommend for any full-time, part-time, or temporary employment or contractual relationship if the person will have or has the potential to have unsupervised contact with the students. So background check for any new employees or contractors who will have unsupervised or maybe have unsupervised contact with students. The rest of this section is taken directly from section 254. So this is 254A. 254 is background checks for superintendents. So it's the same process. There's also, I don't know the section designation number off the top of my head. There's also a requirement that school districts conduct background checks for their employees. We're adding this language in for AOE employees and contractors who have unsupervised contact with students. The process is the same as it is for superintendents. And there is a fee required, which is, I believe, why this bill is referred here. So, okay. Page 35, subsection C, a request made for the background check shall be accompanied by a release signed by the applicant on a form provided by BCIC, a set of the applicant's fingerprints, and a fee established by BCIC that shall reflect the cost of obtaining the record from the FBI. The fee is paid by the applicant.
Is it paid by the applicant and all? I personally have had many a background check to work with youth in schools, and I have never paid the fee myself. I've always had it paid by my employer.
This is the language that's used for superintendents. I don't know off the top of my head what it is for school district employees or volunteers. There's also a provision related to volunteers. I suppose this would be a policy choice.
Thank you. Oh, and we're not asking questions until the end. Look at me, terrible. Continue on. I'm so bad at following that rule.
I have summarized, I mean, unless you want to get into the nitty gritty of the process of.
Okay, this is the last.
This is it.
Oh, great.
There's one update to another section that requires AOE to figure out, it adds the Agency of Education into the group of folks who are responsible for keeping records if they request background checks. And then the whole act would take effect on July 1, 2026.
And the other places in statute where we require background checks say that crime victim services can set the fee and we don't have any.
I can only speak to Title 16, so let's just briefly take a journey there. So someday I will rewrite Title 16 and this language will not live in the Secretary of Education chapter because this is not an obvious place to look for this language, but here we are. So educator licensure employment of superintendents. This is the language that I was referring to. I made this, I modeled the 254A language in H931 right after this. It's almost exactly identical. And the fee is paid by the applicant here for superintendents. Public and independent school employees and contractors, let's see. A request for records shall be accompanied by a fee. The fee shall be paid in accordance with adopted school board policy.
And the Vermont Crime Information Center is part of state government?
Yes. They are established by statute.
Only two things. Yes, Representative Kim.
So if you're asking for, is this more than the fingerprints? Does that cover it?
I'm sorry, does what cover what?
Background check.
What does the background check cover? I don't know that I can speak to that.
Worried about one?
No, but you're at fingerprints and a fee established. But then you're asking about documentation. You said something about that.
If the age, so this section, I think maybe what you're referring to is there's a statute about the continued validity of criminal record checks and maintenance of records that talks about what you do if you are the entity that requested or caused to the background check to be requested. So basically the employer in this situation. What do you do with those records once you get them? this statute talks about that, and since AOE was not doing background checks, they were not included in the list of folks who need to have these policies. And so all this section does is add AOE in there.
I'm gonna request that Ezra, you find out how much the Vermont Center for Crime Victim Services charges for fingerprints, and we actually put that number in the statute. And that we have it paid by the employer. Because I think having people pay out of their pocket to do things for their job is weird. That is my Representative Odie, I see that you
Well,
want to say
I
something.
just respectfully disagree. This is in accord with school board policy, and I don't want to decide.
So this is for people who work at the Agency of Education.
Oh.
Okay.
Yes. The agency works with very few people.
Did this come forward around the state board and the students on the state board of ed?
No, this is a request by the agency.
I understand, but did they specify like how many agency staff and?
Oh, no, I
I
am, no.
imagine it's quite few, but maybe Ezra can share that with us. Yeah.
Maybe
Representative
I would like to say, why would we put a number in here? Because it might go up by $1, up by $1, and then we'll be in this position of having a number in there, and then we have to deal with that.
So, because that's what we do with fees.
What?
That's what we do with fees. We put a number in statute. We don't delegate that authority unless we absolutely have to.
Okay, then can we say this is,
So we can put an inflator on it if you want.
yeah, that would make me happier,
Cool.
But not me.
but not.
Is there any provision for someone who applies for a job at AOE and they just had a background check somewhere else for a certain amount of time? Would they have to go through and pay the fee even yet again?
Under this language, yes.
In my personal experience, that is unfortunately how it works.
I don't know how much work Ezra has done on this. My limited work with VCIC is depending on who is responsible for paying the fee. If it's a government entity, there may be different provisions. I don't know.
Representative Holcomb.
helpful to anticipate how many people are affected, only because every time we change policy and expand the class of people who are required to undergo fingerprinting, we create a traffic jam at VCI.
Very much so. And I think they're just clearing up that traffic jam right now better than they have in a long time. So certainly don't want to jam it further.
And other states handle this. I mean, I actually did some research around this because of some of the pre-K childcare things. They actually pre-approve for the sector, and then the approval is portable so long as you work continuously within the sector. We have chosen a particularly complex way of doing this work.
That is also my personal experience. So we're going to hear from Ezra about maybe how much money we're talking about, how many people we're talking about. Thank you, Beth.
Alrighty, for the record, Ezra Holton, Joint Fiscal Office. Is it all right if I share my screen? All right, so since Beth went ahead and gave you all a great overview, we will just hit the fiscal impacts. So I have the fiscal note up here, and the Joint Fiscal Office estimates that this bill would have a net neutral impact on state expenditures and revenues. So on the expenditure side, this stems from the payment of dues that Beth talked about from Vermont joining the Interstate Compact for Education, otherwise known as the Education Commission of the States. So member states pay dues to the compact. However, Vermont currently pays these dues through the AOE budget, and they are currently within the fiscal year 2027 AOE budget. So this would not represent a new expenditure. This bill does not introduce a new revenue source nor an appropriation for this. So the General Assembly would need to continue to appropriating the AOE for this purpose. Annual dues are about $53,000. Like I said, they're within AOE's budget and they have remained unchanged over the last several years from what I've heard from the field. So on the revenue side, that's the background fingerprint check fee that we were just talking about. So we estimate that this bill would raise a de minimis amount of revenue through this fee. The fee would cover the cost of obtaining AOE employment applicants' criminal records if they are in a position where they are or could be having unsupervised access to students. The VCIC estimates that this fee would be about $12 per applicant, and that this covers the cost of retrieving those records from the FBI. So in my conversation with them, brief conversation with them, essentially they receive a bill from the FBI for all the record requests that they've submitted, and then they request that funding from the entity that they receive that request from. And so they just take that $12 and send it to the FBI.
So for these 34 people, if we have the state general fund pay another part of the state general fund in order to cover this $12 fee,
$400.
that would be revenue neutral, yes?
Yeah, so it'd be about $400 as it's written. It's the applicant that would be paying this fee to VCIC.
I'm asking if we amend it.
Sure.
Okay.
Well, so it would be moving from AOE to VCIC. However, it sounds like the VCIC is then taking that money and paying it. So actually that would be removing.
About 400?
Yeah, so it's about $410 rounding up for the 34 individuals that AOE estimates would pay this every year.
Okay, so that sounds like doing this would not be a huge burden to Vermont Criminal Information Center and would also not cost the state an undue burden. And $12, you said, is the fee they charge now?
Yeah, so they believe that $12 is so that's for the background check from the FBI, not to take a new set of fingerprints. So that gets confused with section 257, that reference that this is 254. So just clarifying that. So yes, $12 is the fee for the background check.
One second, just one second. $12 is the fee.
Yes.
For the background check. That's not how much it costs crime victim services?
No, I'm sorry, that is what it costs crime victim services.
Okay, so Beth, I know you have to go. Can you draft an amendment for tomorrow that sets the fee at $12 and asks it to be paid by the state?
And would I need a separate appropriation? Or would you be? Okay.
Represent what, yes.
Someone's later in that request. And
Will you add
it
enough?
sounds like it sounds like the billing's gonna be tricky.
What?
I mean, so, the FBI bills someone, this is, you have the amount of dollars, but the amount of effort of somebody's day, I don't know. No, it's not. I'm just.
I feel like we do this, the state government does this kind of thing all the time. They move money from one department to another to pay for criminal services. Yeah.
I heard you guys say that $12 for basically the paperwork that goes into the FBI, but then you said, what about the fingerprinting? Then another dollar amount?
That's sorry, I was just clarifying that this is only for the obtaining those records from the FBI. So I just meant to say it doesn't include any related work that VCIC would be asked to do. This is just the cost that the FBI charges BCIC to pull these records.
Beth, we're gonna get a good number from BCIS, and we'll send it to you, and you can go have fun in the other committee. Thank you so much for your service.
Used to be something like $34 or something, didn't it? I mean,
That's, I also, yes, somewhere in,
Maybe something.
we'll send them an email and ask them. Yes.
And do we do this every year? Did I hear you say that correctly? This background check, it's done every year?
No, so the background check would be for a prospective new AOE employee. And the Agency of Education estimates that every year, 34 individuals on average would meet this criteria. The new individuals.
And it's accomplished every, what, 5 years or something like that?
I would have to defer to the agency on that.
Representative Maslin.
Yeah, thank you. I think you said, maybe that's it. Our state dues are $53,000 a year. Is it appropriate to ask you or somebody, what do we get for that?
So I could not answer that.
Okay.
I think the education committee thought it was a worthwhile investment of general fund dollars, and
I assume that.
and the appropriations committee will look into that further.
Or I can ask them. I mean, thank you.
Any other questions for Ezra?
Ready for a motion yet?
Waiting on we're gonna wait on an amendment for that. Is Representative Odie, do you have something? What do you want to do about it? I don't mean, everyone thought that was funny. I'm just like, I'm in like, do you want a different amendment? Do you not want an amendment? Do you not want us to background check the people at AOE? I just don't know what you mean.
I guess I think that it's okay for a new employee to pay the amount.
Oh, really?
I do. I mean, I have to think about all the people in the state of Vermont who pay this. More thing. I mean, I can see saying yes, and I can see saying.
Representative Holcomb?
I
think, yeah.
Sorry, I just didn't want to cut you off. So I'm a little unclear, this is the miscellaneous ed bill, and it feels like there's some miscellaneous definitions, and is that the amendment that Beth is working right now? It seems like there's.
No, Beth is just working on the fee thing.
Okay.
Because that's our direct jurisdiction, and it's different than how we usually do fees.
It seems like there's some definitions that might be helpful when we're thinking about rulemaking, but it also seems like there are some things that we haven't been able to model because we don't collect the data currently, whether it's, what is a pre-K day? How much time are people spending there? What are the demographics of kids enrolled in pre-K? So there's a bunch of things that we've talked about over the course of the session that if we don't request this data somewhere, it won't be available next year. And one of the challenges that we've had as a state is that because we aren't paying attention to baseline data, it is very difficult to evaluate policy impact, and it's also very difficult to anticipate planning for transitions. So I was wondering if we could use the last section, or whatever it is, section 4 of this bill, to both put in place some definitions that might support rulemaking, but also make some of the data requests that we feel are important to evaluating and supporting policy decisions that we haven't been able to make this year.
I think we need to, yes, maybe. I think we need to figure out how fast we can turn that around so that we don't kill the miscellaneous education bill with the amount of time we're spending, and check in with the education committee about if it would be considered a friendly amendment, given that it's sort of touching their stuff a little more.
So what would be the best process?
To go talk to the reporter of the bill from education and find out if they would accept the amendment if we offered it.
Reporters for every section, so I will do that.
Okay, thanks. You could talk to the chair if there are different reporters for
the chair.
Yeah, I didn't realize they have different reporters for every section.
That's what I was told. I'm just telling you what I was told, because I've been trying to figure out who to talk to, and that's.
Thank you for not doing
I've
that.
I've already had some of this conversation with someone.
That brings us to the next item on our agenda, which is the yield bill. We're just gonna talk about it again today, because that's so fun. Julia, will you come share table again? Thanks. Thank you, Teddy.
Julia Richter, JFO. There are a few documents on the committee page under my name. Two of them are the same as you've seen every week. It's the decision points of the yield bill and the annotated guide in case you need a refresher on what a line means. And then the final one is a new education fund outlook. I'm gonna go ahead and share my screen. So I want to start out before talking about why this is new, by talking about what is not new. And what is not new is that there have been no changes to the underlying data. And so this is pretty consistent with every year at this time, we sort of freeze all of that underlying data because you're getting close to making a decision. It's hard if the underlying components are changing. So these are the same numbers that we've been looking at over the last few weeks. So this does not reflect any data changes that Kelly was talking about earlier. So what we're looking at here has been winnowed down from the last education fund outlook that we were looking at, and is reflecting only columns that would include, that would have a uniform average bill change. The difference is how the one-time monies are used for that uniform average bill change. So column A, this is the same of what we've looked at. This is the FY26 preliminary. Column B, these are using those December 1 letter modeling assumptions. So no general fund monies, the entirety of the education fund surplus to uniformly lower rates, and solving for an average bill change. And we see that to be an estimated change increase across all three classes of 10.1%. Column C, this is if that 105 million in one-time general fund monies were to be used in 1 year, fiscal year 2027, to uniformly lower property taxes. And that would result in an average estimated increase across the three classes of 3.8%. Shall I just keep going? All right. Column D, this is the construct, another construct that you've seen before. This is applying 1/3 of the 105 million in general fund to uniformly lowering property tax rates in fiscal year 2027, resulting in an average estimated increase across all three classes of 8%, and then reserving the remaining 2/3 in the education fund for future years. And finally, this last column is a new construct. And this is applying, using half of the 105 million of one-time general fund money to uniformly lower property taxes, and then reserving the other half for the following year. We can see there the half of that 105 million being reserved. And that would result in an estimated average increase across all three classes of 7%.
Any questions for Julia about what we have in front of us? Do you want to show us that row about Medicaid you were talking about before? Just like a fun little.
Yeah, I would love to.
Little sneak.
So that's what we see here in column 7.
That's a row.
In row 7. It has been such a long day. Thank you. That's what we're seeing in row 7, the Medicaid transfer. And so you can see that's that piece that's coming into the education fund as a revenue source. We also know that the money is going back to districts, assuming they can use that as offsetting revenues within their budget, going to be decreasing the education payment, which we see in line 11. So they're in the background of calculating that number, reducing that number.
Any questions about the columns from anyone? Representative Bodie.
All right, so maybe I just want, everybody gets the same advantage. Is everyone advantaged the same way by that Medicaid 9 million on there on line 7 down to?
I'm gonna respond using a word that's not advantage, and say that this Medicaid transfer line, these 9 million are being treated just like all other revenue sources in the education fund, all other non-property revenue sources. So when you think about the way that property taxes are set, is it's the sum of all education appropriations, all appropriations out of the ed fund, minus non-property revenue sources. So that's where the Medicaid transfer would fit in. And then the remainder needs to be made up in terms of property taxes. The reason I'm not using the term advantage is because it could be construed as value laden. And also there are like the interesting mechanics of the education fund where dependent on a district spending decision, the impact of the yield in relationship to its per pupil spend is going to have a proportional effect.
So I could use a value laden statement because I'm not nonpartisan staff. And say that you could say that any of the sources in the ed fund actually give more of an advantage to higher spending districts than lower spending districts. And you could say the same thing about the weights, but like that adds a degree of confusion to how we think about things that can be fun some days and not less fun other days to add more. But we really set up a wild system to do all this. Representative Higley.
I may have asked this question before, but under the other sources, wind, solar, and fund interest, I think I understand the wind and solar, that's based on production. It's down 700,000. What's the fund interest?
The interest from the interest earned from the components of the education fund.
Which components?
Like a fund, like all funds earned interest, it's a revenue, and that is the interest earned by the education fund.
Is that easy enough to break out?
The interest portion, yes, because it's included in the revenue forecast from the economists. Some of the other smaller pieces are estimates, but the revenue forecast, if you go to, and I can share the link again with Sorsha. If you go to the revenue forecast and you go to the available education fund revenues, there literally is a line labeled interest.
Okay.
Now that you can see it.
So I add all those lines up. That's what I'm gonna get for the total of interest. Fund interest.
Do you want me to just go ahead and share the interest? All right, give me 1 second. Right. So this should look familiar, right? This is the revenue forecast. And I guess I should have scrolled to the relevant page before pulling it up, just to avert your eyes. But way down here at the bottom, the very last page is the available education fund
revenue forecast update. And so what that means is this is incorporating the splits that we have under current law. So we're not seeing, for instance, the entirety of the meals and rooms tax, all that's raised, we're only seeing the portion that's dedicated to the education fund. And the interest portion that you are interested in can be seen here in this row. So you can see that in FY 27, it's forecast to bring in 1.1 million compared to 1.5 million in FY 26. You can see how that's decreased, but was a bump up in 22, so.
Thank you.
Any other questions about the outlook? Okay, we're gonna make a decision soon. Gonna be great. Every option that we have, like, there are pros and cons and big implications of each of them, right? We're balancing like consistency and stability with, you know, taxpayer relief with educational, you know, opportunities. These are hard decisions we're making. Does anyone need anything else in order to have a conversation tomorrow about where we think we all want to be on the yield bill? Because remember, it's just like a 3-sentence bill, so there's not a lot of, we're not going to spend a lot of time actually looking at the legislative language. So I appreciate John continuing to sit here.
And you talk about putting some things into that yield bill.
There are a few little things.
You want me to say them?
Sure, yeah.
So John Gray, of the Legislative Council, the statewide adjustment correction for the property tax credit issues. There's the very TIF overpayment piece. There's, yeah, H802, the census block grant inflator. I think that's it.
Think about it and let me know. We're gonna vote on the yield bill probably on Friday morning. Okay. Enjoy the rest of your day, wherever you may go, and see everyone at 9 tomorrow morning.